Okay, so I am doing my trach suctioning, and the first thing I would do is I would verify the order before going into the patient's room. And when I go into the room, I would introduce myself to the patient. I would maintain privacy. I would perform hand hygiene, and I would also explain to the patient why we are doing suctioning. I would then identify the patient with 2 patient identifiers and, double check the order again. And then I would don some regular gloves after performing my hand hygiene. I would turn on the suctioning, and I would make sure the tubing is close by for me for when I'm ready to begin suctioning. I would raise the level of the bed to my height, and I would also make sure that the patient is in semi-Fowler's position or high Fowler's position. I would put on some some protective eyewear so that nothing flies into my face. I would get a towel to cover the patient, so when I'm suctioning, nothing gets on the patient. But before I do that, actually, I would auscultate and make sure the patient even needs suctioning. Like so. And I would keep this around my neck so that I can auscultate between suctioning. So my patient is now covered with the towel. I would get everything ready. So I have my suction catheter, and I will open up the outer packaging without touching the inside and keeping it sterile. I would have a sterile basin. I would have my normal saline, and I would make sure that it is not expired. And I would lip it since it is already open. And I would pour the saline into the basin with the label up. Get that out of the way. I would open up my gloves and have that ready. And so then I would also hyperoxygenate my patient right beforehand. So now I would remove my regular gloves and put on my sterile gloves. I had to improvise because all we had left were the 9s in this, so I put some smaller ones in here so that they would work for me. And my glove is ripped, but we are going to pretend that it is not ripped. They're still sterile. Okay, so then I would now grab my suctioning without letting it touch anything, and both hands are still sterile, so I would get it all wrapped up nicely in my right hand because that is my dominant hand, like so. And then now I'm about to make this hand unsterile because I'm going to grab the suctioning tubing and attach it. Like so. It'll stick for me. Okay. So this hand is still sterile. So first I would irrigate the tubing. Intermittently, make sure it goes through. And now I am going to insert it, and I'm going to go all the way down until I meet resistance or until the patient starts to cough. And when that happens, will remove it in a circular motion slowly, and it would be in there for no more than 10 seconds. And then and I'm doing this intermittently, and then I would auscultate again, which I should have left these in my ears in order to auscultate again. So let me see if I can do this one-handed while keeping this sterile. And I did. So then I would auscultate again. And I would irrigate it. And I would suction again, like so. Meet resistance, start to draw back, circular motion, intermittently, and pull out. And then I would go ahead and auscultate again to see if he needs it again. And I think he's good. So we are done. So I would now brain fart. I would now remove the suctioning. I could go ahead and turn it off. I would hyperoxygenate him again, like so. Oh, well, like so. And I can wrap this into my glove that somebody so smart taught me that I could do, and then wrap both of those into the other glove, and I can dispose of it properly in a biohazardous garbage can, and I'm done with that. So then now I would clean up the patient. I would make sure he's all right. I put him in the lowest position on the bed, make sure bed rails are up. I would make sure the call light is next to him if he needs anything else, and then I would document that I performed the suctioning, and I would document his vital signs, and I would also document what I had the suctioning at, which would have been 100, and I would document the output and the consistency of his sputum. And that would be it.
Could you stop?